I understand that your current work focuses on gender and health worker migration. How did you arrive at this particular topic?
I'm very interested in gender and migration generally, and much of my research is focused on the migration corridors between Canada and India. And in India, my focus has mostly been on northern India, on Punjab. And I was interested, though, in looking at cases where women migrate as skilled professionals, independently or with their family. And to do that in India, one really needs to look at Kerala in southern India, because Kerala has a very long history of nurse migration. So that got me interested in nursing as an occupation to examine. So I did my research in Kerala, and while I was doing the research in southern India, I met individuals who had been moving to Canada, actually through an educational intermediary that was based in northern India. So I kind of ended up going back to northern India, and that intermediary was working with a Canadian college that happened to be in my hometown. So it was very interesting. And then that took me back to Canada to look at the experiences of those nurses who'd come through that intermediary in the Canadian market. And at that time, there was a great deal of policy interest in the integration of internationally educated nurses into the Canadian labour market. Yeah, I'd be happy to. I would say that for me, my interest, there are sort of four main factors that drive what I think are the academic significance of this work. So with regards to the migration of healthcare workers, one of the first important factors is the impact it has on national economic and health systems. So for sending countries, those countries have to deal with the provision of health services to a population that's often facing a much higher share of the global burden of disease, and often a much lower ratio of health professionals to the population. So when healthcare professionals migrate overseas, of course it creates a huge healthcare problem for those countries. But what's interesting is that some countries have actually looked at the demand for healthcare professionals overseas and used it as a way to boost economic development. So if you consider countries like the Philippines and India, here there is, in many cases, an excess training of those professionals in order to create a surplus. I mean, surplus not necessarily to the public's need, but surplus certainly to the uptake by the public and private sector. And those individuals will send back remittances, and so it becomes an economic development agenda. For receiving countries, there is a desire, of course, to keep the costs of healthcare low. There's also a desire in most places to deliver a safe and efficient healthcare system. And for policymakers in those countries, they may be interested in having a flexible labour market. It might involve some elements of de-skilling of certain cadres of health professional because they want to keep costs low, but they still want to provide efficient service. And so the incorporation of internationally trained healthcare professionals has become an important market for health managers and policymakers to kind of draw upon in order to satisfy their own needs, because again they're facing an aging population. The number of healthcare professionals may be diminishing for various reasons, especially if those countries aren't training enough. So from a policy perspective and economic development issues, the first thing is the significance for countries themselves. Then the second important point that drives my research interest is really to think about the global inequality of healthcare access that exists. And so what we live in a globalizing, kind of neoliberalizing, market-based economy, and health is an industry. People can move to access the healthcare services they want that they may not be able to find in their own country. I mean, some people can move if they have the resources to do so, just as workers. So patients will move, workers can move, and we also move products. We move pharmaceutical products, we move body products. Then the third reason that I think this is an interesting research agenda is about demographic change. We're living in an aging population. We have, in some core countries, a diminishing labour market, but we also have more women entering the labour market. which creates care needs. And we also have more women engaging in international migration. And so that's an important element of this research agenda. And then the final one is really to think about the care crisis. So a number of feminist scholars, many of them connected to ARI, have been interested in the issue in terms of how is it that people are able to deliver the sort of social reproduction needs that they have. So how do communities, families, individuals, reproduce themselves and the conditions of their livelihood? How do they do this in the face of a sort of neoliberalizing, restructuring global economy where opportunities become diminished? And often the way in which individuals decide to address that places them within a sort of global migration circuit. And for many, the care services market becomes one of those options.
You are a human geographer. What does a geographer bring to the study of gender and health worker migration?
Yeah, I think geographers have a lot to offer, and there are probably three ways in which, in my case, I sort of see that happening. First of all, I think all of these processes are really spatial processes. So we're talking about the mobility of workers, of patients, of products. They're all forms of mobility that that kind of indicate these social transformations that are occurring. And also, behind all of this is the significance of global inequality. And global inequality is really a geographical expression of the market-based transformations that are occurring in the global economy. And I think for us, it's important to understand who is really at the receiving end of these benefits and who is carrying an unfair burden. The second point for geographers, I think, is to understand what many have called methodological nationalism and overcome it. So methodological nationalism is a kind of criticism of the assumption that everything starts and ends with the state, with analysis of the state, in the state, within the state. And that's clearly not adequate when we're looking at such globally kind of transnational processes as healthcare worker migration and care migration. And so for geographers who can engage in a much more sort of transnationally positioned research and can understand how this sort of connection and relationality between places, that's important in my opinion. And then I think the third point is to recognize how complex space and relations between space has become. So in the past, we used to easily identify issues of development levels with a nation, with a particular place. And nowadays, we have to recognize that the complexity that exists is even evident when we look into the state, the relationships between urban and rural areas, and also socially, between those who have wealth, those who don't have wealth. So we might look at a country and think by its GDP that it doesn't have adequate healthcare services, but you might find in the largest cities, in some of the poorest countries, there'll be a very significantly well-resourced medical establishment, but only certain people can access that establishment. And so these are geographical conundrums, and that's one of the important things in this area.
This is clearly a very live topic in policy terms. How do you engage with policymakers and ensure that your work has impact beyond academia?
This is a real challenge, and I've found over the last few years some of the projects I've done have had an explicit intention to try and engage with policymakers. And I think the first thing is to think about how you frame your message. So policymakers are obviously dealing with competing demands. So for managers of healthcare systems, for politicians, policymakers, they have to make sure that they are delivering an adequate healthcare service that is efficient and maintains productivity and safety. So you have to recognize those demands, but you also need to understand the particular system that you're working in. So, for example, in Canada, if I'm talking to policymakers about the significance of internationally educated healthcare professionals and how they might be integrated into the health workplace, I might approach them through a lens of issues of diversity in the workplace and also cultural competence in the delivery of healthcare services, because Canada has a very diverse population. Canada has an immigration stream that leads to permanent residents and to citizens, and so all of those citizens have a right to expect fair and equal treatment in healthcare service delivery. So that is a kind of an argument I could make to a policymaker about making sure you integrate international healthcare professionals is both fair and just, and also will help us deliver healthcare in a much more effective and safe manner. Now, that might be different in Singapore, for example, where the migration system is much more based on temporary visas. But again, I think for Singaporean healthcare policymakers and managers, I think the issue of safety of delivery to a diverse population and issues of productivity and retention will still find some interest. So it's about framing the message. I think it's also about the kind of product that you use. So I have employed policy briefs, very short 4-page papers, policy backgrounders, synthesis documents can be useful. Community stakeholder meetings can be very beneficial for delivering some research findings and then getting feedback from the community and having them engage with each other in a kind of a cross-practitioner or cross-policy platform. So those have been useful. And I also find films, audio-visual, short films can be very effective at getting your information out there. So I worked with a really great team, and we made a couple of short films on the nursing shortage and on the experiences of internationally educated nurses. And those films have had upward of 8,000 views. So there's certainly an audience that's interested in that. And in order to do that, you need to have a very skilled team, and I was lucky to have that on board with that project. And then finally, what's interesting as a social scientist, as a geographer, I have a range of outlets for my research, but I think looking to the health and the medical journals is actually a really useful thing to do when you're engaging in this kind of research. And I found that the medical community is very open to contributions from social scientists, and I found publishing my work in some of those outlets has been very well received and has helped me connect with a very diverse group of researchers, but also policy practitioners and others. So those are useful ways, I think, to try and have your knowledge be mobilized a little more effectively.
Thank you.
Thank you.